Hi there, can you hear me?
Yes,
Okay, great. Is your name pronounced Etzer?
yes, it is.
Great. Hi, Etzer. My name is Michael. I'm going to be your facilitator for today. How are you?
I'm doing well, thank you. How about yourself?
I'm doing all right. Thanks for asking. Is this your first time doing a simulation with us?
Yes.
Great. Well, then, welcome to Walden Simulation Center. I just want to make sure that we're on the same page about what you have to do before we get started.
Okay.
Okay. Well, it sounds like you and I are going to be doing two simulations. I see that you booked two in a row. So we'll get started with the communication scenario first. I just want to make sure that you know what you have to do. So, in your own words, can you give me just a brief description of what the scenario is and what you'll be doing?
Yes, from my understanding, it's a scenario where a nurse prescribed medication, a wrong medication to a patient. So now I'm trying to determine, and one of the respiratory therapists find out that the wrong medication was prescribed. So I'm
Hmm.
trying to determine exactly what transpired and how can we prevent it from happening in the future.
Exactly. You'll be speaking with three individuals. It'll be the nurse, Darius,
Hmm.
Dr. Linda Barry, and a friend of the patient. His name is Max, who's a respiration therapist. He's, technically a medical practitioner, but not someone who is an employee at your hospital.
Okay, is it the name of the prescriber? Is it Danny, Dr. Danny? Because
Yes, Dr. Danny Barry, sorry.
okay, Danny. Okay, all right.
Yes.
Okay.
Um, Great. Well, it sounds like you know what you have to do, but I just want to make sure that you know this. Keep in mind you'll have a maximum of 15 minutes to speak with everyone. You don't need
Okay.
to use all the 15 minutes, but if you start to go a little bit over, eventually we might have to cut you off. So just keep that in mind as you're pacing yourself, okay?
No problem.
Great. All right. And when you're done with the conversation, I'll come back. We'll talk about how it went, then you'll be free to go.
Okay, thank you.
All right. Should I switch you over to the meeting?
All right,
I'll switch you over now. Good luck, and I'll see you afterwards.
thank you.
One moment as I stand by. Oh, here it is.
Hello.
Hi.
Hi, thank you, Darius, Dr. Danny, and Max for meeting with myself today. How's everybody doing?
Doing well.
Doing okay. Yeah, I'm doing fine.
All right. So, well, first and foremost, I want to say, thank you for taking the time to meet with me because one of the items that I wanted to discuss, it's something that's of utmost importance because when we're dealing with patient healthcare, we have to make sure that we are accurate as far as when it comes to prescribing medication. So something transpired on the floor, and I wanted to get a better understanding of what transpired and how we can improve on preventing it from happening in the future. So one of the things I wanted to find out is, Max, what exactly did you see on the floor today?
So basically, I heard from my friend Jasmine,
Mhm.
what transpired that she was, you know, coming in just for a migraine, and then, after being given some medication, she had a seizure. So, I just wanted to visit her to see if she was okay. Um, she wasn't really sure what was going on, and I noticed there on the table that
Mhm.
there was medication that was Profol, and that's antihistamine, so that was kind of obvious.
Mhm.
So no one really realized that the cause of the seizure was that the wrong medication was given, and it was just sitting right there. So it just seemed like there was a little bit of a disorder.
Okay. All right. Well, thank you for bringing that forward, Max, because I know it's not always easy, but I'm glad that you did, and that will give us an opportunity to improve on our current workflow to prevent something like that from happening in the future.
Yeah.
Yeah. So, Dr. Danny, can you please explain to me what did you notice or what transpired or and what medication was prescribed?
Yes, so basically, I was with Nurse Darius. We were writing out the form for the patient Jasmine. I gave my clipboard with a medication order to Nurse Darius and asked him to go to the pharmacy to pick up the medication and administer it. Then I just went about my rounds. Next thing I know, I hear that the patient was having a seizure. So, me coming back, I was under the impression that the correct medication that I wrote down, which was Proton, was administered. Had I, you know, known that, someone wasn't following orders the right way, obviously I would have looked at the medication. But since was under the impression that the right medication was given, I didn't think to check that.
Okay. And Dr. Danny, if you don't mind me asking, is this usually the protocol that usually followed where you would prescribe the medication and you don't double check or verify? Is that the right
Well,
process?
I wasn't the one who administered the medication. I
Okay.
simply prescribed it and wrote it down, and it was Nurse Darius's job to get the right medication from the pharmacy and administer it.
Okay. And one of the things that I wanted to basically set the expectation, this is not a meeting for us to pass blame. It's basically so that we can understand where are the opportunities and prevent it from happening in the future. Because we are fortunate that Ms. Jasmine is doing better. You understand? So it was not a a dire situation because it could have been a whole lot worse. But I'm glad that she is doing a little bit better. But we're just trying to understand exactly how we can prevent that from happening. So,
Yeah, I understand.
Nurse Darius, exactly. Can you explain to me or share what happened or as from today?
Um, yes. So I I was given a clipboard and I brought it down to the pharmacy, and they were kind of confused with the handwriting. They couldn't really tell what it said. So I was like, should I call the doctor? And they were like, no, actually, we figured it out. Yeah, we know what it is. So I just kind of, didn't make anything out of it. They gave me the medication. I went upstairs and administered the medication. But when I saw that, Jasmine was having a bad reaction, I immediately stopped and just called Dr. Barry.
Okay, so I'm glad your quick reaction as far as when you notice the adverse reaction on the Miss Jasmine, you were able to stop it and call the nurse so that we can reverse the action. I commend you on that. But here's my question to you. It's just that, Nurse Darius, what do you think we could have done differently to prevent that, especially when you noticed that there were confusion within the pharmacy regarding the
Yeah.
handwriting of the prescription?
Honestly, that's never happened before, and I was a little confused myself. I definitely should have called to make sure and to double check before getting the medication. They just kind of made it seem like it was fine. So I just kind of went along with it. But honestly, I never want that to happen again. So, um, I'll definitely, double check next time.
Okay, so it's just that again, this is one of those uncomfortable conversations, especially when it comes to patient lives at risk. One of the things that Nurse Darius that I would probably would do differently next time, especially when a prescription is given to you, I think it's important for you to double check, confirm the name of the medication, so that
Yeah,
once you do get to the pharmacy, if there's any hiccups, you can let them know. Okay, you know what?
Exactly.
This is the name of the medication, and after they give it to you, you can double check as well, so that because we don't want those things to continue to happen because that is a big liability for the hospital, and to make matters worse, it is someone's life at risk. You understand? So
Yes.
it
Yeah, I
is,
understand.
yeah, so it is very important for, for all of us to be on the same page, especially Dr. Danny and Nurse Darius, so that when a prescriber prescribe something, for all of you to be in sync and know exactly the name of the medication, so we can prevent something from happening in the future.
If I can interject, it just, since you said earlier that we, you know, should refrain from assigning blame, it sounds like we're focusing on like what Nurse Darius could have done differently, and that's good. I definitely agree with that, but I also think that, you know, when conducting the investigation, it would have been the first thing to do would have been to check if the medication was, the correct one or the right dosage, because it's kind of unfortunate that an outsider had to be the one to figure that out. So you know, just saying that, everyone could do something differently in that situation.
Yes, I
I was
definitely.
under the impression that the orders were followed, so
No, well, the thing about it is just that Dr. Danny, I think it's important for, we proper diagnose the patient, because that is also important. And when we are prescribing the medication, make sure we write legibly so that the nurse can understand the prescription, what's written, and the right dosage is also labeled, or so that we can make sure that the right medication and the right dosage is being assigned to the patient.
well,
I
I
think this.
wrote everything down. If they didn't understand it, then, that sounds like a them problem and they should have asked me.
Well, it's just that I do understand. I understand where you're coming from, because being on the floor as a provider can be a little bit chaotic. But it's just that I think it's an opportunity for all of us to learn. And I don't
And
think,
also, when something bad happens, make sure that you check
yes,
everything
yeah,
instead of just
because yeah,
assuming that everything went well.
that's correct. It's just that when something like that transpires, it's an opportunity for all of us to learn from it, so that we can prevent it from happening in the future. You understand? So I understand. It's just that the opportunity is there for Nurse Darius, but as provider as well. It's just that we have a role to play in making sure that we are prescribing the right medication, the right dosage, and sometimes, you understand, and make sure that the nurse understand the prescription and the right step to follow. So yes, I do understand where you're coming from, Dr. Danny, but this is one of those opportunities where we all can learn from it, and so that moving forward, we can prevent it from happening in the future.
Yeah, I understand.
All right. Well,
Hmm.
it's just that, is there anything that you would, both of you, or well, all three of you guys would like to add? Okay. So it's just that, again, thank you. Just a quick recap. Moving forward, when a patient comes in on the floor, we make sure once they are properly diagnosed, if we prescribe them a medication, make sure that the prescription is written legibly, and the right dosage is listed, and communicate to the nurse as well, so that we all can be on the same page. And for on the nurse's side, so we make sure that once we go to the pharmacy, the right medication is provided and the right dosage is prescribed to the patient.
And if
Okay.
mistakes happen, then make sure that you
Yeah,
check everything.
that's correct. And if mistakes do happen, make sure, it's just that I think Nurse Darius did the right thing by stopping and reach out for help. And make sure that we communicate it to myself, so that we can see what are the steps we can take to make sure that those mistakes doesn't happen moving forward.
Okay.
All right.
Yeah.
Well, thank you all for your time today. I do appreciate the hard work that you are doing,
Thank
and
you.
have a great rest of your day.
All right, Etzer, take a deep breath, shake it out. You're all done.
Oh,
How you feeling?
yeah, it's good. It's a little bit awkward talking to three Avatar. This is a first for me, but overall wasn't that bad. I think probably the
Yeah.
most challenging was knowing the name of the medication, was the reaction to it was. I think that's probably the most challenging thing.
Okay, great. Well, looking back, is there anything that you would have that you felt like you did well within the simulation? Any strengths?
The strength that I noticed is just that I think I took had a good hang of the conversation, so I didn't let it go, too left or right. So we stay at task. We were able to address the issues that presented. So I think that piece, I think I did well on that.
Good, good. And then, is there anything that you would have done differently looking back?
Um, yes. I think one of the things that I think I focused too much on the nurse side because initially I did mention that it's not about passing blame, but yet I feel like I was focusing more on fixing the issue that presented with the nurse Darius versus focusing on both the provider and the nurse.
Mm, okay, good. Makes sense. It sounds like you're already growing from this experience. Would you say that this was a beneficial experience that you could use in real
Oh,
life situations?
oh yeah, no, definitely.
Great. Okay, well, we're all done. What we're going to do is we're going to sort of transition to the next one, but I'm have a little bit of a confusion. And I want to clear it up with you. Okay, Ed, sir?
Yes.
So I see in my schedule right here that you scheduled another simulation for the next set part of this hour. Um, but it's for on the schedule it says that it's for the same simulation. Did you mean to do that or did you mean to do the conflict scenario?
It's the conflict. No, I believe it's the conflict because I have the conflict and it's a conflict scenario.
Okay, yeah. It looks like that's what you, and I guess that's what you intended on doing, but it shows right here both of them are communication. I think we can still do it. I hope that that
I'm
we
trying to,
have the right avatars in
okay.
this one.
Yeah, because I'm
So
looking
what
at
we're
it.
going to do,
Because I'm looking at on my, okay, maybe.
what does it say on your side
Oh,
for the
no,
5:30?
you are right. So I did click on both of them is showing communication. You are right.
Okay. That's okay. That's okay.
Okay.
We're going to end this session and then you have to, I know it sounds silly, but you have to just go into the next meeting. So let's do that and then I will go ahead and see if we have the right avatars. And, we'll make do. Either way, you'll have both of the recordings. It's the same scenario.
Okay.
So,
You
well, it's
said,
not the same scenario, but
okay.
like we will make sure that you still get to do the next scenario. Okay. So I'll see you in
Okay.
a second.
No problem. Thank you.
Thank you.